At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's.
Where kids come first.
Good afternoon and welcome to our latest Let's Talk Children's Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. On behalf of STHS Children's, thank you for joining us. Now, there's no denying that parents want the best for their children. That's especially true when it comes to their health. That's why it's vital that parents be knowledgeable about common health issues that affect children and how to prevent or delay them. So to help children prioritize their health and help those parents help their children prioritize their health, STHS Children's hosts these Let's Talk Children's Health webinars since last year through healthcare professional-led education and advice on a wide range of health issues that affect kids. Parents can be better prepared to monitor their children's overall well-being. Now, in this installment, we'll be talking about respiratory syncytial virus, simply known as RSV. The respiratory illness spreads easily among babies and children, and the risk increases in the fall and winter seasons. For many children, RSV can feel like a cold, but it can lead to serious complications and may require hospitalization if not treated in a timely manner. In severe cases, RSV can be life-threatening, resulting in an estimated 100 to 300 deaths in children annually per the National Foundation for Infectious Disease. So to talk more about this important topic, we've invited Dr. Ivelisse Santiago, a pediatric hospitalist with STHS Children's, to join us. Thank you so much, Dr. Santiago. Now, first of all, you have had a busy day already so far. You were a hospitalist at STHS Children's. Are we ramping up already to prepare for this busy season that comes with RSV?
We sure are. We are making sure that the hospital is ready to receive these children, both in the emergency room and, of course, in the pediatric wards, and, of course, the intensive care unit, which, unfortunately, sometimes we have to go that route.
And we know that we had a really busy RSV season last season. What was that like in the hospital?
It was very busy, very ill children. RSV, especially in the infants less than a year of age, and more so on the ones that are less than 6 months of age, can be really serious. It can lead to life-threatening complications like pneumonia, and it can lead to the patient needing advanced care, like I mentioned before, in the pediatric intensive care unit, in a very rapid manner. So it's important that when families see that the children is having any respiratory issues, if they see them coughing frequently, if they see them not eating as usual, if they see that the cough attack or cough spell lasts a long time, that the baby starts to turn red when he's coughing, or the child, then those are the signs that are starting to tell you this is starting to get a little bit more serious than just a cough, maybe a dry cough, maybe a slightly productive cough, and the child keeps on with his usual activities and feeding.
And when it comes to children, obviously parents are worried about their health, and so they'll go see their pediatrician, or they'll go to the hospital whenever they're noticing something is not necessarily right with their child. But when it comes to RSV, is it one of those diseases that can really intensify quickly?
Correct. Especially in the younger population, like I said, and in children who already have some compromise with their respiratory system. For example, children who has history of asthma, or history of cystic fibrosis, or children that were premature babies and spent a while under the NICU care. Those babies already have a respiratory system that is a little bit compromised, like I said before. So it's a lot easier for them to deteriorate. It's
Okay.
a lot easier for them to go into the inflammation that this virus causes. You're looking at the bronchi area, the little bronchioles and the little bronchi. There are tubes that are bringing air from the tracheal area into your lung tissue. So imagine little hoses, and imagine that inside those little hoses, instead of a clear passageway, there are areas that are swollen. So when the air is trying to go in or out, it has to deal with this, like delay, this obstruction, okay?
Yep.
And also it causes bronchospasm. So all these little bronchial areas are going to kind of go into a spasm and constriction. So it's a lot harder for this individual to do his proper work of breathing.
And when we talk about the season, we say fall and winter months. So do
Correct.
we start seeing it like at this time, like
Yes.
at right around September?
Actually, we see RSV the whole year. It's not as seasonal as it used to be, but certainly a lot worse than this time of the year.
So September until about
In about March, April.
Okay.
Yes.
So this is the perfect time to get all of the education we need to make sure that we protect our children. So
Correct.
you have a great presentation for us. So let's
Yes.
get started.
Okay, there we go. So we're going to be talking about RSV, which stands for Respiratory Syncytial Virus, and it is a highly contagious respiratory virus. It will infect the nose, the throat, and the lungs, and the symptoms make it hard to distinguish from the common cold or other viruses that cause respiratory illnesses, for example, the flu or the COVID-19. So according to the Cleveland Clinic, every year we see about 58,000 to 80,000 children under the age of 5 that are hospitalized because of RSV. It is the leading cause of infant hospitalizations in the United States, with 2 out of 3 babies getting it by age 1. So how does it spread? We'd like to know that, of course. It spreads through droplets, which are produced when we cough, when we sneeze, or also, and this is very important, it can stay on infected surfaces, and if we touch those infected surfaces and then touch our eyes, our nose, our mouth, which is something that children so often do, it will be very rapidly spreading, especially in the school and in the daycares, and of course at home. For many children, the RSV will feel like a cold, but then it can lead to serious complications. It might cause severe symptoms like trouble breathing, and most concerning is that it spreads easily among babies, and it makes them more susceptible to other illnesses too. Like I mentioned before, babies that are born prematurely and those infants that are less than 6 months of age and also have other health issues, including heart disease, will be facing the highest risk of complications from RSV. If it goes into the lower respiratory tract, it can actually cause all the inflammation that I mentioned before, leading to bronchiolitis in children that less than 2 years, over 2 years of age, bronchitis, or even pneumonia. So we do have data from the National Foundation for Infectious Diseases, and it tells you that RSV can be life-threatening, resulting in an estimated 100 to 300 deaths in children annually. So we're going to be looking for symptoms that are going to tell us that something more serious is going on. For example, difficulty breathing, a cough which may progress to wheezing, also runny nose. Like I mentioned before, the child starts to eat less, He doesn't want to even do any drinking of his formula. Liquids are diminished. In the intake, they will turn a little bit fussy, irritable, progressively more so as they face more difficulty breathing. Their activity decreases, of course, because if you don't move as much, you won't need as much oxygen. And more seriously, they can go into apnea, which is basically they will stop breathing, making little pauses, but at times they can stop breathing altogether, and that will be extremely dangerous. You can also see their little fingernails turning blue, and that's another big concern. In cases like that, of course, you need to call the ambulance. How is it diagnosed? They will do a lab test in which basically they collect the sample through a nose swab. It's nothing extremely invasive, and we get the report within 20 to 30 minutes on the short test. On the longer test, it can take 2 to 3 hours. And also, there's more detailed studies that they can do for the virus, but those are sent out. We will, if the patient is having fever, also consider doing a white blood cell count, but that's what we would call extra laboratories to complete the evaluation of the child. Chest x-rays will also give us an idea if there's a pneumonia involved or more serious situations. And in the case of wondering if there's very serious lung complications, they might even do a CT scan of the chest. Sometimes if there's a fever, we'll add also a blood test. And on occasion, depending on how septic the patient might look, we might also look for infection in other areas of the body, like the urine. There's several treatment modalities depending on how ill the individual is. So we will start many times with oxygen support if we see that the oxygenation is not adequate, that is less than 94%. We will also use the help of the respiratory technicians and our registered nurses in cleaning the airway via suctioning, especially in the younger population, the infants. IV fluids we will use also to support good hydration, because if the body is well hydrated, it will have the opportunity to fight this virus better. And it will also allow all of the phlegms that are being produced to be easier to be suctioned out of the respiratory tract because there are more fluid in them. In very severe cases, we not only use the oxygen that we apply through a nasal cannula, then we have to go into like high flow nasal cannulas, or we have to go into actual mechanical ventilation, which is more serious. And of course, that will be done in the environment of the intensive care unit. So many families will ask, how can we avoid my child having this? We start, of course, with hand washing. We should be frequent and thorough with plenty of soap and water. We also keep the children well hydrated because that will help the immune system function at its best. We also teach the kids to keep their hands away from their faces because you can receive this virus infection via the nose, via the mouth, and even the eye. And more importantly, stay away from sick individuals. And I would highly recommend this for children, like I mentioned before, who has asthma or cystic fibrosis, premature babies, who already have conditions that will put them at higher risk. Also, inquire about the RSV immunization with your pediatrician because that one is available as early as 2 months of age.
That is all very important information that I think parents can benefit from. So let's just talk a little bit more about RSV. Now, I read that most people get RSV as babies, and most all children get it by the time they turn 2. So this is something that is really common that we need to know about. This isn't a rare disease that you may get. This is almost everybody gets it at some point, and usually before the age of 2.
Correct.
And what do you think that reason is that we get it so young? Is it just?
It is one of the viruses that we barely get a vaccine for. It's widespread in the population, so it's very easy to come in contact with it. The incubation period, which many people ask, is about 4 to 7 days. Okay. And the person will be exposed to it and will gradually show symptoms of it. Sometimes it can stay in the upper airway, so all you see is nasal congestion, maybe a dry cough. But once it reaches the lower airway, that's when we start to see more symptoms of the frequent phlegmy cough. And once it can get into actually be complicated with a bacterial infection, then you see more serious illness. Because once the tissue is swollen and damaged by the virus, then bacteria have a blast. It's like, oh, okay, you already started the problems here, and I can easily attack this host.
And it's one of those things that obviously children under 2, their immune system hasn't fully developed yet, so you haven't been exposed to all of these different things. So,
yes, of course, the older children have been exposed. They have developed all the possibilities of that their immune system gives them to fight these viruses in a more not only efficient manner, but a more in a faster way, let's put it like that. And the younger kids are starting to do that. So sometimes it's okay, you want them to deal with these viruses, they have to, but you don't want them to have a high viral load, because then it's going to be a more serious infection. So you're at home, the older child gets it from school, brings it home, you have your baby, well, try to have the older child away from the little one. Maybe the older child can wear a mask inside the house, of course, wash the hands, and the baby will get exposed, but it might be, like I said, a lower viral load, and maybe he will only stay in the upper airway, and maybe he will develop antibodies against it, but without a catastrophic disease.
Now, this is a question that I believe I know the answer to, and it's a common question a lot of people ask. Is RSV just a childhood disease? And the answer is no, right?
No. And actually, the elderly population suffer a lot from RSV. Many times they don't even know they have it. This cough that won't go away. So they also have a vaccine for the elderly people, and it's recommended, I believe, after 65 years of age, or after 60 if you have other conditions like diabetes and all of that. And not only is good because it will prevent the adult from having it, but it will, if the adult comes in contact with it, they will have a milder disease, and they won't be as infectious to their grandchildren or the kids that they interact with.
And I think that's really important to know, because we live in a community where our grandparents sometimes live with us, or we spend a lot of time with our grandparents. So if our grandparent is exposed to any issue, the elderly are exposed to any issue, and they develop it, and then they come in contact with the child, that could be a serious problem that develops.
Correct. Many of our grandparents are even caregivers, so they're nannies to their grandchildren. So it's important that they also take care of their RSV vaccines.
All right. Now, what are the first signs of RSV? Like, what are we going to be seeing? What are those initial signs that we'll see?
Okay. Each person will vary a little bit depending on how you respond to it, but usually you start feeling that little general malaise, like, I am getting a cold. You start to see a little bit of rhinitis, right? Sometimes it's just a stuffy nose, but eventually it can run. The nasal congestion will be visible. You might get a little bit of a sore throat at times, and eventually you will develop a cough, right? And the cough can be dry initially, but it can progress to a productive kind of cough. And if it really turns to be a more serious infection, then you're going to start using your accessory muscles of breathing. You're going to breathe faster because you want to keep the proper oxygen level in your body, and so your body is going to be doing all these things in order to achieve that. So it's going to have what we call tachypnea. You will see the person breathing faster. You will see retractions, of course. You can see in babies, usually you see the little tummies going in. You will see the intercostal retractions. The older kiddos, you can see those better. On the side of the rib cage, you will see kind of the ribs going in and out, in and out. The more serious one are the suprasternal retractions.
Okay.
If you see a child where this area on the top of the sternum is going in, then that's a sign of what we call air hunger.
Okay.
So that child really needs to be seen right away. If it's an asthmatic, then you can do certainly an albuterol treatment, but go ahead and seek medical advice.
But you're looking for that area just right there where you can totally see where where it's sinking in, because you're taking those deep breaths to try to get that area.
Right. And the child, of course, will be looking anxious because they're having a struggle to breathe. Babies will be fussy and really cryful. And eventually you might start seeing them cough and kind of get what we call a circumoral hue, like a little bluish coloration. That's very serious, of course. You can see bluish coloration in the fingernails, toenails. Those are more serious presentations. And when they are extremely ill, sometimes they just do apnea that I was mentioning before, in which they are actually breathing but stopping, and they stop 10, 15 seconds. Those are true emergencies. You have to call 911 immediately.
Now, when it comes to obviously those signs, a child, when they get anxious, they can't breathe, and you see that they're getting anxious. How do you help calm? Because I know when you get anxious, that impacts your breathing. So how do you recommend a parent help calm the child?
If it's an infant or any child, you put him in an upright position, right?
Okay.
You're not going to have them lying down. You're going to put them in an upright position. You're going to make sure that the area is well ventilated, maybe waiting for the ambulance to get there, right? If you have a child that has asthma and they have a nebulizer at home, you can certainly apply the nebulizer immediately. If the child is having any fever, you can certainly start putting some cool compresses to bring it down. If they're having a lot of struggle breathing, you don't want to be giving them anything to eat, because then they can do an aspiration of the food, and they could have an aspiration pneumonia. So you want to prevent that. And that will be helping the child breathe till you get help from the ambulance people.
Now, some of those initial symptoms sound very similar to obviously a flu or the common cold. So how did you differentiate between the three?
Yes. So usually with the flu, you will get generalized body aches. You will get the fever is more frequent with the flu. You can get more of a sore throat. The older children will complain more of a sore throat with the flu. And the person will be kind of hypoactive. The child will be more wanting to sleep, more wanting to kind of not be playful. But more than anything, the generalized body aches. They share a lot of commonalities, yes. Because so they will both have the rhinitis. With the flu, you can also see a lot of headaches. Yes, more than with the RSV.
Now, we talk about obviously that RSV, the virus can live on a surface. About how long can it live on a surface? Like Do we? Because I know we talked about it during COVID, and
Yes,
like, okay,
yes.
just wipe everything after you touch
I
it.
don't know the exact number of hours, but I would say a good 4 hours.
Okay.
So it's important that we clean those surfaces frequently.
Especially, and thinking about
in
all the
daycare
services,
centers.
doorknobs, you're always opening doors, their toys that they're playing with, you got to make sure you're wiping those down, things
Right.
like that.
Yes.
Now, are repeat infections possible in the same year?
Oh yes, it's just like any other virus. You will have different strains. Yes, you can get it again.
You can get it in the same
In the
year, and a
same
few months
season.
later you may get
Yes,
another
yes,
case of
you
it. So
can.
you have to be really careful.
Yes, and it can last. Usually, it lasts about 10 to 14 days. The milder cases are just about a week, but some people can linger with it for 3 to 4 weeks.
Now, when it comes to how contagious it is, from a scale of 1 to 10, how contagious would you say RSV is compared to other diseases that we've
it's probably in the 9 to 10.
Okay.
Yes,
And that's
I
because it's
think.
you're sneezing, it's the droplets, so you're sneezing, you're
Yeah.
coughing, a laugh. I know that there's a commercial for RSV for the elderly and for the vaccine where a bunch of people are laughing, and it just shows how simple it is.
Going around, yes.
All right, and then now most of the kids that we see, this is the return to school. That's why I think it's also part of the season is those schools and daycares are really a hotbed for RSV. So what advice do you have for parents who have their kids going to a daycare or to a school?
Well, as soon as they get there, wash their hands because they don't know what they're bringing from the house. And then whenever they have a meal, wash their hands before eating, wash their hands afterwards. The toys, like you mentioned before, try to keep them as clean as possible. I guess every night just clean them very well. Children are going to be sharing their toys. That's part of the way they socialize and part of the way they learn. So if they receive a set of toys that is clean in the morning, so hopefully it will be less spread of whatever is available in the community at that time.
And when we talk about how contagious it is, I know like when we talk about certain diseases, there's a period where you're most contagious between these certain days. Is there something with RSV that we can look at?
Usually in the first week is when you're the most contagious.
Okay. So that's when you really should be taking them out of school, most certainly,
Ideally,
keeping them away from everyone else.
Ideally, yes. Unfortunately, many times because it's confused with a common cold and the kid doesn't look too ill, they keep going to school. But the school age child already, like you had mentioned before, has developed an immune system, so they will be able to deal with it. I worry more like my asthma patients or cystic fibrosis, certain heart conditions, then you worry more that they're going to have more complications. So if the parents want to consider just keeping them home when they start with a cold, just to kind of prevent them from getting worse too rapidly, or in the school, they can actually stay away from other children that are sick. I don't know if the teachers can help identify, hey, this one has asthma, maybe we can keep him
Separate
over
them
here
a little bit.
a little bit away from the other one that is coughing constantly to his face. You know how it is.
I was in a meeting yesterday where somebody was coughing right next to me, and I was like,
Yes.
can I just back up a little bit
Can
so
you
I can
just
understand
move a few
how
feet
a
away?
teacher
Yeah.
might want to be able to do that.
Yeah.
Now, how long does RSV usually last? Is it something that kind of runs its course in a week or 2
goes
weeks? Or
In about a week. In
Okay.
about a week. Now, unless it's a more complicated case.
Now let's talk about untreated RSV and those complications that can happen. So obviously hospitalization is something that may be required if you're not handling it right away.
But remember, there is no actual medication that we can give for
Yeah.
RSV. So that's the first thing that we have to keep in mind. So we basically treat the symptoms.
All right.
So as they present, the person will be treated as according to the symptoms that they are presenting. Sometimes if they have an excessive rhinitis, then we can give them some loratadine or something to dry that up so they're not constantly cleaning their noses. If it's a sore throat, then on the older child, you might consider like chloraseptic spray or something like that. If it's hurting too much, some Tylenol, some Motrin. For the cough, we cannot give anything for cough according to the American Academy of Pediatrics for children less than 6 years. So we just have to let it run its course. And sometimes we do nebulizer treatments on those that are wheezing, although the literature really doesn't recommend doing this unless they are wheezing, because there's no actual proof that it makes a big difference.
And then you run the risk of pneumonia, which is, I think, something that you hear about in older populations, but children can get pneumonia from not treating it properly.
Right. Like I said before, you can get what is called an infection with a bacteria that is going to attack the tissue because it's already, let's put it like that, temporarily damaged, yes, by this viral infection. So if that happens, then the child might need antibiotics, but not always do you need to give antibiotics.
You really need to be talking to your doctor before you're talking about any medication and treatment for it.
Correct.
And then there's also middle ear infection, so you can even it can even affect the ears.
Yes, if you have a lot of production of congested fluid, it can actually cause a little bit of the middle ear effusion. And nowadays, if it's not really febrile, sometimes they just observe them. It used to be that we would be giving antibiotic for middle ear infections right away, but now there's certain criteria to do that.
Now, you talked about how to diagnose RSV and the nose swab. How reliable is that nose swab when it comes to?
Well, it's pretty reliable. The most important thing is to take a good sample.
Okay.
So you have to really dig in there a little bit to get a very good sample. And then it is reliable. It's over 50% of the time reliable. And if you use a PCR, it's more reliable. It's more in the high 70s to low 80s, yes.
And how do you deal with a small child when you're working with a nose swab to make sure that you're keeping them calm and that they understand, especially a baby, I can only imagine.
Well, to a certain extent, babies are a little bit easier because you can gently but firmly, control the little heads and control the little hands, and then you can clean the area. An older child, you can explain to them what's going to happen and see if they will cooperate with you because you're explaining how to do it. And many times, sometimes you can bribe them, like, I'll give you a little lollipop, or I'll show you how to do X thing that they want to do, color a book or something.
Yes.
And so you can always convince them.
And then when it comes to obviously the chest x-ray and the CT scan, those are obviously for more progressive cases. So you're not necessarily going to show up at the hospital and automatically need this, this, and this. It's, as long as you're treating it right away and you're handling it as early as possible.
Correct.
Now let's talk about, you talked a little bit about treatment. So there really is no treatment for RSV. You're just basically treating the symptoms.
The symptoms, correct.
And you're letting it run its course.
Correct.
All right. And one of the things that I know that, and we touched on this, is that we live really close to the Mexican border. People go and buy medication across the border all the time, one of those being antibiotics. And antibiotics are not used to treat RSV, and you should not use them to treat RSV.
Unless they are really needed.
Unless that, but that's obviously the conversation with your doctor.
Right, no.
So
it's not going to make a difference unless the doctor is actually suspecting, like I said before, a pneumonia. Then you can go ahead and use them. But otherwise, they're not going to make a difference, and sometimes you will run into side effects, like diarrhea, for example, from the antibiotic, that is just going to compound the whole thing.
Yes. Now we hear a little bit about respiratory distress. So what exactly is respiratory distress, especially when it comes to RSV?
So it's basically the inability to have the function of bringing in the oxygen to your lung tissue and being able to do that exchange of oxygen for carbon dioxide that we're supposed to do. And we're supposed to do that in a physiologic manner, which is according to your age group, because the respiratory rate, which is how many times you breathe per minute, and it varies with the age, should allow you to do that function without extra work. Okay. But once you get infected, remember the analogy that I was doing at the beginning of the hoses, right, that are obstructed, then that person is going to have a harder time bringing that oxygen in and taking the carbon dioxide out. And they have to start using all those accessory muscles of breathing that I mentioned before. Sometimes they even get pain on this area because those muscles we don't use all the time. So the lower thoracic cage gets involved trying to help. And that's when you see all those retractions. So you not only see the person breathing faster, you see the retractions. Remember the ones that I mentioned on the supraesternal area that are so serious, and sometimes in order to bring air in, especially the children, you will see them opening and closing the little nostrils. So that's another sign of a struggle.
Okay.
So.
Now, during the, right after the pandemic, we saw a huge surge in RSV cases. Was that because part of it is obviously we build up herd immunity, as we've talked about, and I think we've learned a lot about it post-COVID, but kids are sort of develop the immunity, but when you're social distancing, when you're masking, you're not really allowing that immunity to happen. Is that right?
Correct. And there was less exposure too. Because many daycares were closed, many schools were closed, they were doing the schools online, so the exposure wasn't there. And the virus couldn't find hosts to attack because there was nobody anymore. Everybody was in their houses and doing a lot of hand washing and all those things that diminish the possibility of spreading the virus.
So I think we can take a lot of the advice that we had during COVID and make sure that we're paying attention to, obviously we're going to talk prevention now, so washing your hands often with soap and water. How long should we be washing our hands for?
At least 20 seconds,
20 seconds.
Because we are singing the happy birthday song while we do it, or the ABCs.
Or the ABCs, or find your favorite song and make sure that you just sing at least a couple of choruses, the chorus and a lyric or two of it.
And of course, if you were playing in the backyard, then you're gonna take longer, right? Because maybe your hands, you were touching little surfaces out there.
All right.
If you were in school, when you get home from school, I think it's wonderful for children to wash their hands. When I have babies in the house and their children coming home from school, I usually tell the mothers just send them to take a shower.
Yes.
Your school children. And they change the clothing and everything because the RSV can be on the surfaces and that includes the clothing.
Okay.
And so sometimes they tell me, but I go pick them up in the car and they're in the back with the baby. So I said, well, try to at least get a little wipe on their hands, a wipe on their faces,
or some
not have them go.
You definitely
antibacterial.
Yes, just something that you can have nearby there.
And don't have them kissing the baby right away till after they shower, then they can go.
Now, another thing is obviously avoid, and you mentioned it, avoid touching your face, mouth, and eyes with unwashed hands. So this is something, unfortunately, I'm notorious of doing. I'm always touching my face. So just making sure that you're doing that. How do you help kids understand that, especially when they're so little?
I think by example.
Okay.
Kids follow what you do. So if they see you washing your hands, they're going to wash their hands. If they see that you're avoiding touching your face, like you can keep your hands together like this, for example, they will start to just imitate what you do. But and then you can verbally tell them. Sometimes there's you can do like little color books, for example, with showing them the children washing their hands. Tell them can be little germs in your hands, and you don't want to put them in your mouth, you don't want to put them in your nose or in your eyes. And if you have like a runny nose, then you go to the bathroom, grab a Kleenex tissue, clean your nose, and wash your hands, right?
All right.
In school, they might just want to do a Kleenex tissue that the teacher has there, and maybe some antibacterial soap.
Yes.
Okay.
Now, cover your coughs and sneezes, and I know that is super important. And it used to be that you just coughed in your hands and then you washed your hands, and then they were doing the
elbow, yes.
cough in your elbow, but that's still a surface. So, what's the best way to cover our coughs
You
and
have
sneezes?
to
A napkin, a
choose,
Kleenex?
choose the moment. I mean, if you do have the
Whatever
napkin
you
or the
have.
Kleenex that you can use
And
and
throw
put
away.
it in the trash can, and then still wash your hands because maybe something escaped it.
So they do sell those little packets of Kleenex that you can just have with you at all times.
And
so
you
that
can
way
start
at least
teaching the children how to do
how
it
to use
since they
that.
are small. Yes.
All right. Avoid close contact with sick people, and I think that's super important. Don't go to that birthday party. You know, you have to
Yes.
really avoid
Yes.
sick people as much
Be
as possible.
compassionate, right?
Yes.
If you're already feeling ill, then, you know, call your friend, hey, I'm not feeling great, I don't want to go in there, and pass this to your guests.
All right. Clean and disinfect frequently touched surfaces, which is something we've stressed a lot already, but making sure you're wiping down those surfaces as often as possible, cleaning
Yes,
them off.
that is core. And remember your vehicle, remember changing your air filters in your house and the air filters in the car. There's 2 filters in the car, one for the engine and one for the actor air conditioner.
So just making sure you're
So
paying attention to
making sure
that.
to all of that, yes.
And lastly, stay home when sick. So
Yes.
we can't stress that enough. Not only stay away from sick people, but also if you are sick, there's no need
Yes.
for you to be out and about.
Correct.
And then kids obviously have a lot of toys. So when you're washing those frequently used items, toys, remember that toys also need to be wiped down often. And then one thing that I think that we also need to really stress the importance of is not smoking. That babies exposed to the tobacco smoke have a higher risk for getting RSV and more severe symptoms. Is that right?
Correct. Correct. Yes. Smoking will really affect your airways. It can give you a little bit of very subtle inflammation, so it's a lot easier for those viruses to do their damage when they come in.
And then for the babies, that exposure to that smoke, even if you've been smoking and it's on your clothing, that I think
Yes.
that whole smoke
Yes.
aspect can
Many
definitely affect them.
Many people will tell me, oh, I go outside the house, but then you come back and there's all that nicotine smell all over you.
Yeah.
So it's still triggering issues.
All right. So what should people do if they suspect that someone in their family has RSV?
So if they suspect that they have RSV, start hydrating immediately.
Okay.
Of course, try to isolate that person from the rest of the family. If it's an older child that can tolerate a small mask, you can do that. Make sure that you wash their hands and the little faces, because that will reduce the viral load, like I was saying before. And you're going to be on observation mode. How frequently is the cough? Is it worsening? Is the child able to breathe as usual? Is the child breathing faster than usual or less than usual? You're going to be watching the use of accessory muscles of respiration, like I said before, especially the retractions. You will notice that the child might be a little bit less active than usual, but if they're definitely very hypoactive, then you need to also seek medical advice. Basically that, and if they're having a lot of production of phlegm, then see how they can expectorate properly, but if it's very frequently that is interrupting their activities, then also seek medical advice.
And so when should they see the pediatrician versus go to the hospital, the ER?
Well, the ER, you're going to go whenever the patient is having a high fever that you cannot control with Tylenol or Motrin. You can also go if the patient is breathing very rapidly,
Okay.
and if it's something very serious and have all the retractions that I mentioned before, or the nasal flaring, then you call 911. Or if they're having apnea episodes, right, that they stop breathing, then you call 911 and make sure that the ambulance will take care of bringing the child to the emergency room right away. If it's that the child is coughing frequently, eating less, maybe having a fever, but it's controlled with Tylenol or Motrin, but he's not himself, He's unable to maybe eat as usual. He's maybe eating less than 50% of his usual. He's not producing as much urine, giving you signs of dehydration. Then you should go ahead and seek medical advice.
Okay,
if it's just a cough here and there, and yes, they're taking a little bit of a nap, but then play, you give them Tylenol, he gets better, he's playful again, then you can probably watch him, but very closely.
Yeah, so monitor closely for those very initial signs, and then if it's something that starts progressing
first
slightly.
48 hours are very important.
Okay, so those first 48 hours, pay very close attention.
are very important, right?
And then go to your pediatrician if it's something that starts developing, but then if it becomes serious, you're starting to see that breathing difficulty and those fevers that can't be broken, that's when you really need to go to an ER.
Correct.
All righty. Well, thank you so much, Dr.
You're
Satya. We
welcome.
really appreciate your time. I know you have to head back to the hospital because
Right
she's
away.
on call today, where she's actually working today.
Yes.
So we really appreciate you taking time to educate us on RSV.
Okay. Thank you so very much.
And that officially concludes our webinar. Thank you for joining us. We hope you will continue to prioritize the health of your children, and we look forward to seeing you for our next installment of this Let's Talk Children's Health series on Wednesday, October 16th from 5:30 to 6:30 p.m. when we talk about the dangers of vaping. Like and follow the STHS Children's Facebook page for more details on our future Let's Talk Children's Health webinars. And to view all of our previous Let's Talk seminars, all you have to do is visit sthsletstalk.com. Until our next seminar, stay healthy, stay safe, and please continue to prioritize your health and the health of your children.
At South Texas Health System Children's, your child's health is our priority. When they're ill or injured, we're ready to help. Our team includes on-staff pediatric specialists in infectious disease, cardiology, orthopedics, neurology, ear, nose, and throat, and more. Our round-the-clock care features the Valley's first dedicated children's ER. For more than 15 years, we've offered healing and hope for kids. And we're here for your family now. South Texas Health System Children's.
Where kids come first.